Hello, everyone, and welcome to tonight's policy reflection about healthcare. So, this is one of my most favorite topics to talk about because I really got my political career started in healthcare advocacy when I worked for Planned Parenthood of Utah. And I was a lobbyist for Planned Parenthood at both the local and national level, doing policy advocacy during a time when the ACA was moving through Congress and becoming a law during the President Obama administration. So there's a couple of things I want to talk about tonight that have to do with healthcare policy. And I wanted to start by talking about the idea that healthcare is not a human right, based on the policy decisions that are being made by Republicans in Congress and some Democrats, actually. So I want us to really think about this idea of healthcare and what we are starting to see happen in this country, especially because of the cuts that we have made to Medicaid and Medicare, is that there is a new movement towards concierge doctors. So if you have money, you're still going to be able to receive health care because you're going to be able to pay for concierge doctors that for some will literally come to your home. Now, most of us can't afford such a privilege. And most of us end up getting sick before we actually have the opportunity to get care. And the reason I'm talking about this is because I've recently been listening to a couple of podcasts and also a couple of conversations about this issue. And recently I was actually listening to a podcast with Kate Bowler called Everything Happens. And Kate was interviewing Dr. Atul Gawande, about what happens when medicine meets its limits and talking about quality of life and end-of-life decisions and caregiving. And the reason I reference this podcast is because one of the conversations that they were having was based on Dr. Gawande's experience. It doesn't actually cost us that much money to do preventative medicine to keep us healthy. And if we are going to have a government that is interested in saving money and moving money to places to fund wars and other things, there are some very simple public health measures that we could implement and put into place that wouldn't end up costing Americans more in the long run, not just with their lives, but also in preventative care. And the reason I wanted to reflect on this with all of you is because this is a point of advocacy that I think is going to become more and more critical in the next 10 years. And as I was talking about this with some of my friends, one of the things we were talking about is the injustice of most of us not being able to receive quality care when we need it, because as everything is starting to cost more and more money, so too shall the cost of medical care. And one of the things that just came out in the last couple of weeks is a report about the fact that millennials and older Gen Z folks, so ages 25 to 44, are actually dying more often. And I read a couple of articles from Slate and Vice about this. And according to Slate, 62% of the deaths of millennials and older Gen Z, so our people who are ages 25 to 44, wouldn't have happened in any other wealthy country. 62% of the deaths that are being experienced by this entire generation of people wouldn't have happened in any other wealthy country, because these deaths are a result of overdoses, car crashes, liver failure, and other preventable deaths. And as a woman of a certain age, a middle-aged woman, dare I say, these deaths are happening to the generation that is coming up behind us, who should have their whole entire lives ahead of them. And yet they are at risk of dying more often than the rest of us. And this is based on an economic and healthcare system that actually endangers human life and doesn't honor human life. And this is why I'm reflecting on this as a policy, because healthcare is a human right. The right to access healthcare to keep ourselves healthy is a right. And we are not enjoying the benefits of that in this country. We need elected officials who aren't just going to talk about this, but are going to advocate for this and do something about it. And I want to refer to a resource for everyone called $4. The organization is called $4, FOR. $4.org is their website. And the reason I'm referring you to that website in particular is because they talk about hospital financial assistance, because every hospital actually has rules to give hospital financial assistance to people in need. And the reason I really love $4 is it's an incredible organization that engages in advocacy to help patients negotiate their medical bills so that they don't have to file for bankruptcy. Because people file for bankruptcy because of medical bills. That's the number one reason people file for bankruptcy in America. And so if you go to $4, you will they have all these great reports about charity care, about helping people access charity care, and how to access resources so that people don't have what is referred to as bad debt from unpaid and unaffordable medical bills. And this is why this is important. It's important because as more and more people lose access to good insurance, to insurance that covers their medical costs, more and more people are going to end up in financial chasms that they cannot cross because they have been overwhelmed and inundated by their medical bills. And this is going to start to happen more and more because of the cuts in Medicaid and Medicare, and also because of the changes that are being made to insurance policies and coverage. As more and more providers leave places, particularly for obstetric and gynecological care, people are going to be experiencing higher and higher medical costs for their reproductive health. We already have a problem in rural areas where they are experiencing medical deserts, where there is not a place to receive medical care, preventative care in particular, because we don't have enough family practice docs to engage in good family practice medicine with people. And so the reason I want to bring this to all of your attention is because this is something that is not expensive and easily preventable through good legislation. And I think we have to start having these conversations with each other so that we can start holding our elected officials' feet to the fire when it comes to medical care. There's a big push here in Oregon for healthcare for all, but that should be a federal standard, providing people with health care should be a federal standard, because if our workers aren't healthy, they can't work. And if people aren't healthy, they can't help engage in raising their families. And this is a no-brainer. This is an easy, low-level, not super expensive way to ensure that we are providing the people of the United States of America with a healthcare system that doesn't kill them too early. And this has been going on for a long time. So this is not a new phenomenon, but it is a phenomenon that we have to address before it's too late. Because our young people are relying on those of us that are in power and who are in positions of power to do something to help them survive into their old age. This isn't just about fixing the problem as it is right now. It's about creating generations of people that can thrive into their old age as they are aging. Currently, our system does not allow that to take place. And so there's a couple of policy strategies. One of them is to stop the bans on contraception, because when people have access to contraception, their livelihoods go up, their ability to earn money goes up, their ability to take care of the kids that they have goes up. It's a win-win and a no-brainer. The second one is to provide medical care for everybody. We should not, in the year 2025, be living in a time where people do not have access to money to pay their medical bills. And we're talking about a $14 billion access gap in charity care. This is unacceptable. The fact that hospitals fail to provide at least $14 billion annually in financial assistance to patients is an atrocity. And hospitals, U.S. nonprofit hospitals, are required to give free and discounted charity care to people who cannot afford their bills. This is a consumer financial protection issue. It is an issue that is critical for the people of Oregon. And fortunately, Oregon does require that hospitals are responsible for charity care. However, the implementation of that policy is deeply problematic. And $4 released a report in February of 2023 that talked about how Oregon hospitals avoid financial assistance laws to charge patients without increasing their revenue. So we as a nation, we as elected officials, we as people who are running for office need to start reflecting on how we are going to not just talk about this, but actively work and advocate to do something about this. And we have an opportunity in this election to do something, to think about how all of these things are intertwined. When I was doing policy work, we looked at how public health is wrapped into the economy, is wrapped into whether or not people can work, is wrapped into whether or not people can take care of their families. And so we need to be thinking about policy from this perspective of how are we going to improve our economic system so that it no longer endangers human life. And I want to read to you this quote from Louis Prada from his article in Vice. He says, "This is a direct result of political choices prioritizing private industry over public health." And so as you are making decisions in this election, I want you to think about electing people to Congress who know what it is like to advocate in a system that seems to be pushing back against public health. That was my job. My whole entire job was to convince Republicans that they should vote for measures, healthcare measures that improved the lives of families. And I did it very successfully. We need someone who understands how to push up against private industry to enact policies that are in the good of all, because we all deserve a better life. And a better life for all of us means that we have people in power who understand how to speak the language that needs to be translated so that we can implement healthcare policy that is good for all of us and that doesn't increase our medical costs, that would even be good for the healthcare industry overall. And we have to start being willing to have conversations. I mean, I have talked to insurance companies. I have lobbied next to the lobbyists for insurance companies. I have worked to pass pieces of legislation that improve outcomes for people's health. And that means being able to talk to private industry and figure out what it is that's going to translate well while we are in the middle of this madness of stripping away people's rights to healthcare. So just to give a little point-by-point recap here, what I want you all to walk away with remembering is that our young people are dying more than ever before. We need to think about how healthcare access should not depend on our income or our zip code, that we need to ban private equity ownership of hospitals and health systems, that we need to create incentives and loan forgiveness for rural family doctors and nurses, that we should be looking at policies that expand telehealth, community clinics, and mobile services. We need to think about how we are advocating for Medicaid for all. And we have got to address the fact that our young people are dying of preventable deaths. Our young people should not be dying of overdoses and liver failure and car accidents. We've got to address that as a public health issue, an economic issue, and an issue of overall creating a better life for all of us. So if you have any thoughts on this, I would love to hear it in the comments. I would love to get feedback from you. I would love to hear what your experience has been with healthcare. I really want to encourage you to visit $4, read this article in Vice and Slate, be thinking about how we can be creating policies that are built on the betterment of all of us, which will save the federal government money in the long run and allow us to establish a thriving, beautiful, amazing economy that is not built on the death of our young people. Thank you so much for being here with me tonight. If you want to know more about the campaign, you can go to melissabirdforcongress.com. I also encourage you to follow me on Facebook and Instagram and TikTok and Blue Sky. Just go and follow me on all the socials so that you can learn more about this campaign. We are raising money, and we are raising money for a couple of different things. One of the biggest expenses we have coming up is the voter file. I have to pay $5,000 to have access to the voter file so that I can target and engage in a robust field campaign to make sure that I'm connecting with all of the voters in Congressional District 4. So every little bit that you donate helps. We're also going to be printing literature in Spanish and English. And so for every $10 that you donate to that, we are able to print lit so that we can hand it out to people and connect with voters that way. And we're all, of course, all the lawn signs are coming. And so if you have any questions about where your money goes to when you donate to me, please feel free to also send me a message and ask. And just know that this is a grassroots campaign. So every dollar that you donate to this campaign goes directly to operating in the district and connecting us with more and more voters. I think you're amazing. I'm really grateful that you're all here to support me in this journey. And if you would like me to come to your area, to your town for a meet and greet, you can also connect with me through my website and send me an email, and I would be happy to come and talk to anybody in any neighborhood at any time. So thank you again for listening to my reflections about healthcare, and I look forward to hearing from you soon. Take care. Bye-bye.